Motion carried. To recognize the Leader of the Opposition.
Mr. Speaker, this tired and out-of-touch government has lost sight of the things that matter. And nowhere is that more clear than when it comes to health care.
Right.
In Lacrosse, at the St. Joseph's Health Centre, it's again facing bed closures because of short staffing. Sick patients who need care have to travel out of their community if they need a hospital bed, a situation that's been ongoing since the beginning of July. Does this government think that it's acceptable for beds to be closed at the Lacrosse Hospital?
Recognize the Minister of Health.
Here. Thank you, Mr. Speaker. This government does recognize that it's important for people across Saskatchewan, regardless of where they live, anywhere in this province, including in Lacrosse, Mr. Speaker, that they have consistent access to local health care for their citizens. Mr. Speaker, this is part of why the government had introduced a 4-point action plan for health care to recruit, train, incentivize, and retain health care workers. Mr. Speaker, and that would include the community of Lacrosse. Mr. Speaker, I can inform the House that, and I would extend my apologies to the people of that community. We want to ensure that we have that health care there consistently in their community, but I can inform the House, Mr. Speaker, that all but one registered nurse position has been filled, and we're actively recruiting for that remaining RN position and for the vacant LPN positions currently in Lacrosse. Thank you, Mr. Speaker.
Recognize the Leader of the Opposition.
Mr. Speaker, consistently closed for 5 months. Right. This government made the case during the Athabasca by-election that people should vote for a government MLA if they want to see improvements in the north. It's the same entitled and out-of-touch argument we heard from Goody Hutchings and the federal Liberals. Now, let's make this clear, Mr. Speaker. It was wrong for the Cabinet Minister to say those things on CTV, just as it was wrong for the Premier to campaign that way in a by-election. Mr. Speaker, and it's especially the case when we see the results today. Beds closed for the whole summer through to December. How is this fair to the people of Lacrosse, and why is this tired and out-of-touch government continuing to fail the people of the Northwest?
Recognize the Minister of Health.
Thank you, Mr. Speaker. As I said previously, there is one vacant RN position that is remaining to be filled, and they're working very hard to fill the vacant LPN positions in that community, Mr. Speaker. Community engagement and consultation is ongoing as we work to build health care in Lacrosse, Mr. Speaker. And I can say this government is committed to improving health care for people right across this province. That includes in northern Saskatchewan, Mr. Speaker, where we've announced and opened a new long-term care facility in the community of Meadow Lake, Mr. Speaker, just last summer, Mr. Speaker. In addition to that, a significant investment into the Prince Albert Victoria Hospital, which serves all of northern Saskatchewan, Mr. Speaker, and a new and expanded long-term care home in the community of Larange, Mr. Speaker. It's improving access, creating more beds, hiring more people, more Northerners working in that community, provide a long-term care and acute health care to people across northern Saskatchewan, Mr. Speaker.
Recognize the Leader of the Opposition.
Mr. Speaker, the list of the ways this government is failing the people of the Northwest is long.
That's right.
Documents we received through FOI show that communities in the region went dozens and dozens of times with no local ambulance available. Here's the list. In Lacrosse, 11 calls. Beauval, there were 35 calls. Buffalo Narrows, 56 calls. And in La Loche, 70 calls. That's 172 times where people needing an ambulance phoned, but there was no local ambulance available. Is this, Mr. Speaker, what that government would call building and protecting northern Saskatchewan? Is this what it looks like to the Premier? And how, Mr. Speaker, is this growth that works for everyone?
Recognize the Minister of Health.
Thank you, Mr. Speaker. And in addition to what I stated previously, I would put on the record as well that we have a very, very effective and engaged MLA for northern Saskatchewan, serving the constituency of Athabasca, who meets regularly with myself and the Minister for Rural and Remote Health, bringing those issues, bringing those priorities forward, Mr. Speaker. And I can tell you, Mr. Speaker, as a result of that MLA's advocacy in the constituency of Athabasca, that we have made some significant investments into that constituency, Mr. Speaker, such as under the EMS portfolio, new paramedicine positions in the community of Beauval, Mr. Speaker, other investments into EMS in northern Saskatchewan. Mr. Speaker, earlier this, and not that long ago, earlier this year, the expansion of more addictions treatment spaces in the community of Pine House in the constituency of Athabasca, Mr. Speaker. All projects have been advocated for by a very, very good MLA for that riding. We'll continue to bring that voice to the government table, Mr. Speaker.
Recognize the Leader of the Opposition.
Mr. Speaker, perhaps members opposite need to be reminded that they are voted as government to provide service to people in every area of this province, Mr. Speaker, regardless of who represents them. And people in the Northwest, Mr. Speaker, are tired. They're tired of being taken for granted by this government, as are people across rural Saskatchewan, Mr. Speaker. Since February of this year, there were 579 times that someone in a rural community needed an ambulance, but no local ambulance was available. This tired and out-of-touch government have been in power for 16 years, and let's be clear, this is their record. How does this government justify to the rural members of this caucus that 579 times their constituents needed an ambulance, but no local ambulance was available?
Recognize the Minister of Health.
Here, here, here. Thank you, Mr. Speaker. I'll say it again for the Leader of the Opposition, who apparently wasn't paying attention to the answer I gave previously about a new long-term care home in the community of L'Orange, which is represented by a member from the opposition, Mr. Speaker. So, yes, and we do support communities and constituencies right across this province, whether or not they're represented by an NDP member or by a Saskatchewan Party member. Mr. Speaker, we have invested since 2007 $2.4 billion into capital infrastructure in healthcare right across this province. As I said, Prince Albert Victoria Hospital, Mr. Speaker, Weyburn, the L'Orange long-term care home, the community of Grenfell, where the construction is now underway in a new long-term care facility in that community, urgent care centres in Regina and Saskatoon, Mr. Speaker, a major health renovation project again, where in L'Orange, Mr. Speaker, work being done in Rostern, a new integrated facility in Esterhazy. Mr. Speaker, I could go on and on and on the significant capital investments this government has made for people right across this province, Mr. Speaker.
Here, 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 here.